I think it's so important that we make sure that we know that when pain is temporary, it's only going to be there for a short amount of time, or when it's chronic and it's going to be there a long time, because there are different ways I'm sure that you would take on paths of treating that to make sure that someone doesn't get addicted to painkillers. So, but if someone does get addicted, what is the best way to treat that addiction?
Well, if they do get addicted, there are medications that we can give them to kind of taper them off of the medication so that they can go through a weaning phase and be taken off the medications. Sometimes they have to have the support of an addictionologist so that they can help them with the addiction. And also there would be some input from a psychologist as well to help them with the behavior aspects of the addiction. But I think it's important, Jennifer, if you don't mind, I'd like people to understand the difference between being dependent on a drug and being addicted to one.
Yeah, talk about that.
I think that's important because a lot of times it's misunderstood. People think that everybody that's taking a pain medicine is addicted to it. I don't know if you had anyone that works with you that loves caffeine. I used to have a lady that worked in my office. Mary was a medical assistant, and she loved to have her colas. And if she had her 12-ounce cola, I knew that she could work a room, work the patients. And if she didn't have it, she would have a headache, and she was irritable because she had become dependent on having that caffeine, much like people like coffee. You may know some people work with you. If they don't have that cup of coffee, you want to slip them a cup of coffee.
And I do. I know somebody who has an addiction to Dr. Pepper, and he needs a Dr. Pepper so badly that when he's grumpy, that is the first thing I do is I go find an ice-cold Dr. Pepper and give it to him.
That's right. That's exactly right. And that's what I would do with Mary. I would give her a 12-ounce a cola, because she had become so dependent on it. But what I noticed in a while, that one 12-ounce didn't work as well for her because she had become tolerant. You hear people talk about they're taking more medicines now.
Yeah.
That means they're tolerant. What the 12-ounce Dr. Pepper didn't do for your friend, they now maybe needed 20 ounces because they are tolerant. And that's the same way people become with opioids. And you would say addicted is when that person with that Dr. Pepper now needs 2 liters. They really need a whole lot of it. And we know that the brain changes a little bit with caffeinated products or being addicted to chocolate. It's the same thing that happens when you're addicted to drugs, because addiction is really characterized by 3 things.
Well, wait a minute. I don't think we should ever put chocolate in that category.
You don't think you should ever put?
Because chocolate's important for spiritual uplifting as well.
But there is medical research that people can become what they call a chocoholic.
Yeah.
And that their receptors in the brain can change because they've been on chocolate, so long. And the craving is that they get an intense craving, loss of control over it because they want the chocolate. The difference is you can stop it from a few days and everything in the brain can settle down, whereas when you're taking the opioids, it takes a long time when you've made those brain changes. But I just want people to understand that everyone on an opioid is not always addicted. Sometimes they're dependent, like your friend with the Dr. Pepper. When he didn't have it, he was kind of going through a little withdrawal. He might have had a headache.
Yep.
He might have been irritable because he was withdrawing from that caffeine. And that's what people do when they're on a pain medicine. They don't have it. They withdraw. And that's not an addict. That's a person who's dependent and not necessarily an addict. And I just like people to know that distinction.